Hi everyone, my name is Dr. M. Niharika. I am working as a fertility consultant in Kamineni Fertility Center, Koti branch. Today I will be discussing about the indications or who requires ICSI. So first we will understand what ICSI is and what is the procedure that goes under in ICSI. Then we can discuss about who requires ICSI. So ICSI, the full form ICSI, full form is intracytoplasmic sperm injection. So as the word says, we are going to inject the sperm directly into the oocyte cytoplasm. So that is how ICSI is coined. So ICSI is required or done in patients who require male factor infertility. So there are different indications in whom ICSI is beneficial. So to give a broad perspective, I would like to enlighten that in assisted reproductive techniques, there are two different kinds of fertilization techniques. So here for fertilization, we can do the conventional IVF, that is in vitro fertilization, in which we retrieve the oocytes from the woman and take these sperms from the semen sample when the husband is giving the sample, and in a petri dish or in a glass dish put the oocyte and the sperm together and incubate it in the incubator in the IVF lab for about 24 to 30 hours and check for the fertilization. So this procedure is called as conventional IVF, in vitro fertilization, in which we are only bringing the oocyte and the sperm together. This is more beneficial in patients who are having tubal factor infertility, because if the patient is suffering from tubal diseases where the fallopian tube is blocked, either one tube or both tubes are blocked, or the tube is filled with the infection and it is not open, the fertilization cannot happen naturally inside the body. So to help these kind of patients, we usually do conventional IVF, provided the semen parameters, being the count, motility and the morphology of the sperm, are in the normal range. Then the conventional IVF will be beneficial to the couple, and that is the good fertilization procedure. But this fertilization procedure sometimes has a risk that the fertilization rates might be low, because even though we are placing the egg and the sperm together in the petri dish, sometimes the sperm might not have proper functionality, meaning the count can be normal but the function of the sperm sometimes might be decreased, and so it faces difficulty in penetrating the egg and going inside the egg. So that will result in fertilization failures. So then it was developed that this ICSI procedure was developed, where in patients whom we have seen that the fertilization failure was there with IVF, we have thought about injecting the sperm directly into the egg, so that the sperm has just to provide its genetic composition and help in the fertilization. So this kind of procedure, that is called as ICSI, is beneficial more in patients who are having male factor infertility. Male factor infertility in which there are abnormal semen parameters, as in the count is very low, or there is very poor motility, or these sperms are mostly having abnormal morphology. So what ICSI actually does is, when we are about to do the ICSI procedure, we first prepare the semen sample that the patient has provided with whatever count it might be, even as low as less than 1 million count. We will be able to process and select the sperms under the microscope under good magnification, and select the sperm that has good motility and good morphology, meaning good shaped sperm. In this way, the fertilization chances will be increased and the embryo formation would be increased, and henceforth the pregnancy rates can be increased. So there are few basic requirements or indications where ICSI is needed. One is the advanced maternal age. In advanced maternal age, sometimes the quality of the oocyte might not be up to the mark. So ICSI procedure, that is directly injecting the sperm into the egg, can help in fertilization and achieve better fertilization rates. The other indication would be the male factor infertility, as I've already discussed, decreased sperm count, decreased motility and decreased morphology. So these things, we properly select the sperm that has good morphology and good motility under the microscope and inject that sperm only into the egg and help in fertilization. Also, other indications where we require ICSI is that patients who are having low oocyte yield or poor ovarian reserve. In patients who are already having low number of eggs, we cannot take the risk of, in those patients also, we proceed directly to ICSI instead of first trying with IVF. And previously IVF failure fertilization cases who are there, that meaning patient has already undergone one cycle of conventional IVF and there was a low yield of embryos, or the fertilization rates were very poor with the IVF process. In those patients also, ICSI in the next cycle would be very helpful to achieve good quality embryos. And in patients who are suffering from any genetic disorder, where or in patients whom we are planning to do a pre-implantation genetic testing for aneuploidy screening, also we better do an ICSI, because that assures that the fertilization rates would be more good and achieve more number of embryos. And also in patients who are having oocytes frozen long back in time, and now they are using, now after thawing them, because of the freezing technique, sometimes there is a risk that the covering that is present on the oocyte can become thick because of the freezing media. And in those patients, using the frozen oocytes with the conventional IVF will result in decreased fertilization rates. So in those patients, ICSI procedure is very helpful. And also in patients in whom there are immature eggs also, ICSI procedure is very helpful. So these are the few indications where ICSI procedure is helpful to achieve better fertilization rates compared to the conventional IVF.